Hi, I'm JP Alters, and I'm the Director of Speech Therapy here at Rebound Physical Therapy. Today we have a topic for you. What to expect when your child receives a speech therapy evaluation. Number one, probably the most important for me, is that you're greeted by a seasoned therapist who loves to work with families and children. Personally, I have 25 years in and enjoy the kids because they keep me relevant and keep me in good physical activity. Number two, your therapist desires for parents to be actively engaged in the evaluation. You will attend the evaluation with your child, and the therapist will ask a variety of questions to better understand your child's and your needs. 3, your child will complete a variety of formal and informal assessments to determine if a speech-language deficit is present. 4, the therapist will provide feedback regarding the results of the evaluation and if therapy is warranted. 5, we desire to provide parents with a peace of mind, plan of action, and empowerment. What to expect in speech therapy. Your therapist will use a variety of movement and play-based activities to support understanding of concepts and retention of information. For example, I actually like to do bear crawls in my therapy session. So if I have kids with articulation, sitting for 30 minutes can be really difficult for a kid that's 5 years old, but I can set up stations and I'll do it with them. We'll bear crawl, and we'll work on our words, I'll give feedback, and then we bear crawl to another location. So I'm keeping their brain actively engaged at the same time that they're working on their speech sounds, and I find you get big bang for buck for that. Your therapist will provide functional home-based activities and exercise program to facilitate ongoing education beyond the treatment session. And that is vital for any kid to remediate quickly. And that actually goes in line with the next question. How long will my child be in speech therapy? I get that a lot, and usually from our dads. And every child is different, honestly. Yeah, I've had kids that come in and it only takes a few months and boom, they're done. And then there's some kids that it just takes longer. But honestly, consistent therapy attendance, active participation in the therapy, and I'm not just talking about the child, it's also parents getting engaged. And maybe that engagement is just being present in the room and picking up strategies that the therapists are doing. And then lastly, caregiver education programs and going home and using those programs to advance your child's skills. If you use those 3 strategies together, our desire is to get your child out as quickly as possible out of services. When to see a speech therapist to support my child's speech language development? I've said this in other videos, it's now. If you do have concerns, early intervention is key to identifying and remediating those deficits. The longer that you push it off, the more ingrained those patterns, whether it's speech or whether it's language, those patterns become just deeply embedded. In closing, at Rebound, we desire to partner with you for the benefit of your child and your family. If you have any questions, comments, or concerns, please feel free to reach out to us, and we'll give you a free screen. Thank you very much.